The med student nobody wanted was scrubbing bedpans when they wheeled him in. A ranger, barely alive. Shrapnel buried so deep the attending took one look and called it. There's nothing we can do. Everyone walked away. Everyone except her. 6 hours. That's all she had. The monitors screamed. The blood kept coming. And the attending? He stood in the doorway, arms crossed, watching her fail. Step aside, he said. Let him go with dignity. She didn't move. Her hands found the scalpel. Her training kicked in, training nobody knew she had. And when the Joint Chiefs walked through those doors at dawn, demanding to know who saved their man, the attending's face went white. The med student nobody wanted was scrubbing bedpans when they wheeled him in. A ranger, barely alive. Shrapnel buried so deep the attending took one look and called it. There's nothing we can do. Everyone walked away. Everyone except her. 6 hours. That's all she had. The monitors screamed. The blood kept coming. And the attending? He stood in the doorway, arms crossed, watching her fail. Step aside, he said. Let him go with dignity. She didn't move. Her hands found the scalpel. Her training kicked in. Training nobody knew she had. And when the Joint Chiefs walked through those doors at dawn, demanding to know who saved their man, the attending's face went white. But that came later. Right now, Elena Vance was invisible. She'd been invisible for 3 years. The overnight shift at Metropolitan General was where they put the students they didn't trust, the ones who didn't speak up in rounds, the ones who kept their heads down and did what they were told. Elena had perfected that role. Quiet, competent enough not to fail, unremarkable enough not to be noticed. Tonight she'd emptied bedpans, changed sheets, restocked supply carts, the kind of work that made the residents smirk when they walked past. Vance, one of them had said earlier, his name was Thompson, you missed a spot in 3B. She'd gone back, fixed it, said nothing. Dr. Brennan ran the night shift like a military operation. Ironic, given what was coming. He was old school. 40 years in emergency medicine, he believed in hierarchy, in paying your dues, in students staying in their lane. And Elena Vance's lane was about 6 inches wide. She'd been standing at the nurse's station, filling out paperwork for a discharge that happened 4 hours ago when the radio crackled. Incoming trauma, ETA 2 minutes, military training accident, multiple penetrating injuries, critical status, the ER transformed, nurses moved, equipment rolled, trauma bay doors burst open. Elena stepped back, out of the way, where students belonged. Then they brought him in. Staff Sergeant Dakota Mills. That's what the medic said. 28 years old, Ranger qualified, live ordnance detonation during a training exercise at Fort Jensen, 60 miles north. The gurney flew past Elena. She caught a glimpse. Young, strong, shredded, blood everywhere. Doctor, Brennan was already barking orders. Get me vitals. 2 large bore IVs. Type and cross for 10 units. Chest X-ray portable. Move, people, move. Elena pressed herself against the wall, watching, the old instinct flaring, the one she'd buried, the one that recognized patterns in chaos. She saw the wound pattern before Brennan called it. Shrapnel, high velocity, multiple entry points, chest, abdomen, left upper quadrant. The monitor told the story in numbers. Blood pressure 60/40, heart rate 140, oxygen saturation dropping 86, 84, 82. Brennan cut away the field dressings, examined the damage. His face changed. That's when Elena knew. She'd seen that face before, on other doctors, in other rooms, on other continents, the face that said, "This one's done." Brennan stepped back from the table, stripped off his gloves, looked at his team. This is a surgical nightmare. Multiple penetrating wounds, chest, liver, possible vascular involvement. He's got maybe an hour and surgery would kill him faster than the injuries. Make him comfortable. The words hit Elena like a physical blow. No, but she didn't say it. She never said it anymore. Thompson, get the family contact information. Wilson, set up comfort care protocols. Martinez, we've got 2 more traumas inbound. GSWs, get Bay 2 prepped. The team shifted. Priorities changed. The Ranger became a statistic. Elena stood frozen. She stared at the monitor, at the vitals that were bad but not impossible, at the wounds that were catastrophic but not unprecedented, at a soldier who was still fighting. They don't know. The thought came unbidden. They can't know. But I've seen this before. I've done this before. Brennan was washing his hands, preparing for the next save, the possible ones, the ones that fit into clean categories. He glanced back, saw Elena still standing there. "Vance, didn't you hear me? There's nothing to do here. Go make yourself useful somewhere else. Restock the supply closet or something." His tone dismissive, annoyed that she was still taking up space. Thompson laughed as he walked past. Classic Vance. Freeze up when it matters. They were leaving, all of them. The ranger's monitor beeped, irregular, weakening. Elena's hands found the bed rail. Her fingers tightened. Every instinct she'd spent 3 years suppressing suddenly screamed. "I'm staying with him." The words came out quiet, steady. Brennan turned, looked at her like she'd spoken in tongues. "What?" "I'm staying with him." Brennan's face shifted, condescending, almost pitying. "To do what, Vance? Hold his hand while he bleeds out? This isn't a movie. This is triage. We save the ones we can save. We don't waste resources on the impossible." Resources. That's what he called it. Elena didn't argue, didn't explain. She reached for a pair of fresh gloves, pulled them on. The snap of latex was the only sound. Brennan stared at her. Then he laughed. "Short? Sharp. Fine. Stay. When he codes, call. It. Then go do your actual job." He left. Thompson followed, shaking his head. Wilson paused at the door, looked back at Elena with something that might have been sympathy or pity. Then she left too. The trauma bay fell quiet. Just Elena. Just the ranger. Just the monitor, beeping its desperate rhythm. Elena moved to the bedside, really looked at him for the first time. Young face, jaw clenched even in unconsciousness, dog tags visible above the trauma blanket, blood matted in his hair. She'd seen 1,000 like him, fought for 1,000 like him, lost one like him. The clock on the wall read 0247, shift change at 0830, 6 hours. Elena closed her eyes, steadied her breathing. The old protocols flooded back, the ones from sand and heat and screaming, the ones from dirt floors and limited supplies and impossible decisions. She opened her eyes. Her hands moved to the monitor, checked the readings. BP 58/38 now, dropping. Heart rate 146, compensating. Oxygen sat 79, failing. She did a rapid visual assessment, started at the head, worked down, airway patent, breathing shallow, circulation compromised, multiple shrapnel entry wounds, right chest, left upper quadrant, right lower abdomen. She palpated gently, feeling for the damage beneath. Chest wall crepitus, rib fractures, probable pneumothorax, abdomen rigid, guarding, internal bleeding. Her fingers found his pulse. Weak, thready, racing. This was bad. But she'd seen worse. She'd saved worse. In places with less equipment and more chaos and no backup coming. Elena pulled the ultrasound machine closer, powered it on. The screen glowed. She placed the probe on his chest, right side, second intercostal space. The image appeared. No lung sliding. Pneumothorax confirmed. She moved the probe, subxiphoid view, fluid in the pericardium, possible tamponade. She shifted to the abdomen, right upper quadrant, free fluid, dark. Blood, liver laceration, had to be. The monitor alarmed. BP 52/34. Elena's jaw set. Her mind was already 3 steps ahead. Calculating, planning, decompress the chest, stabilize the pressure, control the bleeding. Then, the hard part. She pulled open the supply drawer, knew exactly what she needed. 14-gauge needle, chest tube kit, scalpel, clamps. Her hands didn't shake. They hadn't shaken in Mosul either. The ranger's breathing changed, more labored, gasping. She was out of time for thinking. Elena positioned herself, identified the landmarks, second intercostal space, mid-clavicular line. She prepped the site. The needle went in smooth, practiced, the hiss of air release, immediate, satisfying. The ranger's chest expanded. His oxygen sat ticked up. 81, 83. Better, not good enough. Elena's hands moved, inserting the chest tube, securing it, connecting to suction. The monitor stabilized slightly. BP 56/36. Holding. She stepped back, assessed. The immediate crisis was managed. But the bleeding continued. Somewhere inside, he was still dying. Just slower now. Elena looked at the clock. She'd bought him time. Now she needed to buy him more. Her eyes moved to the surgical tray, to the equipment Brennan had abandoned, to the tools she'd used in another life. They still don't know, she thought. By dawn, they would. The monitor beeped. Elena pulled on a fresh gown. This is where it starts, she thought. This is where everything changes. Her hands reached for the scalpel. Steady, sure, exactly like they'd been 47 times before. The scalpel felt right in her hand, like coming home. Elena positioned the ultrasound probe over the fourth intercostal space. The image told her what she already knew, what she'd known the moment she saw the wound pattern. Intercostal artery laceration, active bleeding into the pleural space, the kind of injury that killed you in minutes without intervention, the kind of injury she'd repaired 23 times in Mosul. Her hands moved, not like a student fumbling through half-remembered procedures, like a surgeon who'd done this in the dark, under mortar fire, with supplies running out and the next casualty already bleeding on the floor. She palpated the entry wound, fourth rib space, anterior. The shrapnel had tracked deep, probably fragments still inside. But the artery was the priority. Stop the bleeding first, always. Mosul. Patient 23. Same wound, same impossible odds. The memory came sharp, clear. Lance Corporal, 19 years old, IED strike, shrapnel through the chest wall, bleeding out on a dirt floor in 110-degree heat. She'd saved him with a headlamp and a prayer. This was a sterile ER. Climate-controlled, full equipment. This should be easy. Elena pulled the instrument tray closer. Her hands knew what they needed before her brain registered it. Betadine, scalpel, rib spreader, clamps, suture. She prepped the site, painted it brown, draped it. The monitor beeped its failing rhythm behind her. BP 54/32, dropping. She made the incision, clean, precise, fourth intercostal space. The flesh opened, blood welled, dark, venous. She worked through the layers, muscle, pleura, there. The intercostal artery, severed, pumping blood with each heartbeat. Elena's left hand went in, found the vessel, controlled it with pressure. Her right hand reached for the clamp, snapped it into position. The bleeding stopped. Her movements were automatic, efficient, staccato, clamp, ligate, tie, cut, no wasted motion, no hesitation. The kind of precision that came from repetition, from doing this so many times that your hands remembered when your mind was screaming. She was tying off the vessel when footsteps stopped in the doorway. "What the hell are you doing?" Nurse Wilson, voice high, shocked. Elena didn't look up, didn't stop working, saving him. "Get me 2 units O negative and a chest tube kit." Wilson just stood there, frozen. "You can't just... You're not... Vance, you're a student." The authority came from somewhere deep, somewhere she'd buried 3 years ago, now. Wilson ran. Elena finished the repair, checked the clamp, secure. She irrigated the space, no active bleeding, good. She placed the chest tube, connected it to suction, watched the blood drain into the collection chamber. The monitor changed its tone. BP 62/38. Oxygen sat 87, better, stabilizing. But she could feel it, the wrongness, the sense that this wasn't over. There's always more. That's what her instructor had told her, back when she was learning, back when she still had a uniform and a rank and a future. You fix one thing, you find 2 more. That's trauma surgery. That's war. Elena moved the ultrasound probe, systematic, thorough, cardiac views, good. Lung fields, improved. Abdomen. She paused. Right upper quadrant, free fluid, more than before. She shifted the probe, traced the source. Liver. The laceration was deep. Grade 4, maybe grade 5, active hemorrhage. Her stomach dropped. This needed surgery. Real surgery, operating room, anesthesia, vascular access, blood products. This needed things a medical student wasn't allowed to touch. Elena stared at the ultrasound screen, calculated. The bleeding was slow, venous mostly, but constant. He had time, not much, but enough. She was reaching for the phone to call the OR when she heard it, the sound of a coffee cup hitting linoleum, the splash of liquid, the curse. She turned. Dr. Brennan stood in the doorway, eyes wide, coffee spreading across the floor at his feet. He was staring at the ranger, at the chest tube, at the surgical draping, at Elena's hands still inside the incision, at the impossible thing happening in his trauma bay. "Vance!" His voice cracked like a whip. What did you do? Elena pulled her hands out slowly, stripped off the bloody gloves, met his eyes, clamped his intercostal. He's got a liver lac, grade 4, possibly 5, needs exploratory lap. Brennan crossed the room in 3 strides, looked at the wound, at her work. His face went through a series of expressions: shock, confusion, anger, then something else, recognition. You performed a thoracotomy? Are you insane? You're a student. Elena's voice stayed level, calm. He was dying. Now he's not. Brennan leaned in, examined the repair, the clamp placement, the vessel ligation. She watched his face, saw the moment he realized this wasn't luck, this wasn't desperation, this was skill. Who taught you this? Elena's jaw tightened. 3 years of silence, 3 years of being small, being invisible, 3 years of pretending she didn't know things she knew in her bones. Does it matter? It matters when you're performing procedures without authorization, without supervision, without... He trailed off, the monitor alarmed. BP 70/42, dropping again, the liver. Elena turned back to the ranger, checked the ultrasound, more free fluid. The bleeding was accelerating. She looked at Brennan. Argue later, or now, or we lose him. The silence stretched. She could see him calculating, weighing protocols against outcomes, rules against results. His eyes went to the monitor, to the vitals that were better than they'd been 20 minutes ago, better than they had any right to be. He looked at Elena's hands, steady. No tremor, no uncertainty. The hands of someone who'd done this before, many times before. Brennan's expression hardened. Fine. But I'm primary surgeon. You assist. And when this is over, you and I are having a very long conversation. He was already moving, barking orders. Get OR 3 open. I need anesthesia, scrub team, 6 units packed red cells, FFP, and a vascular tray. Move. Staff scattered. Elena began prepping the ranger for transport. They still don't understand, she thought. This isn't assisting. This is what I do. Wilson returned with the blood products, stared at the scene, at Elena moving with practiced efficiency. Vance, how did you... Elena didn't answer. She was already running the mental checklist, airway secured, breathing supported, circulation tenuous, but holding. The ranger could survive the trip to the OR. Probably. Brennan returned, scrubbed, gowned already. Let's move. Now. They rolled the gurney out of the trauma bay, through the hallways, nurses and residents pressing against walls to let them pass. Elena kept one hand on the IV line, one eye on the monitor. BP 73/44, holding. She could feel eyes on her, confused stares, whispered questions. Who is that? What happened? Did Vance just do a thoracotomy? She ignored them. The OR doors swung open. The clock on the wall read 4:02. 2 hours since the ranger arrived, 2 hours since she'd decided to stop being invisible. The surgical team was waiting, instruments laid out, anesthesia ready. Elena helped transfer the ranger to the table, connected the monitors, gave report. 28-year-old male, multiple penetrating shrapnel wounds, intercostal artery repaired, active liver hemorrhage, grade 4 to 5 laceration, hemodynamically unstable. The anesthesiologist looked at her. You did the thoracotomy? Elena nodded. He blinked. Okay. Brennan was scrubbing in. Through the glass, Elena could see him, methodical, thorough. But he kept glancing at her, like he was seeing her for the first time, like he was trying to reconcile the quiet student who restocked supplies with the surgeon who just cracked a chest without blinking. Who the hell is this girl? She could see the question on his face. Elena scrubbed beside him. Muscle memory. 2 minutes. Nails, fingers, hands, forearms. The water ran brown with blood. She caught a reflection in the steel. For a moment, she saw someone else. Younger, in fatigues, covered in sand and blood and exhaustion. Captain Vance, the surgeon who saved 47 lives, the surgeon who lost one, the surgeon who disappeared. Elena blinked. The reflection was just her. Again. Medical student. Nobody. But Brennan was still watching, and the questions were coming. She could feel it. The walls she'd built for 3 years were cracking. One emergency thoracotomy at a time. They entered the OR, gowned, gloved, ready. The ranger lay between them, still fighting, still alive. Because of her. Brennan positioned himself. Primary surgeon, like he'd said. Scalpel. The scrub nurse placed it in his hand. He made the initial incision, midline laparotomy. Elena stood across from him. Assistant, supposedly. But her hands knew what came next. Retraction, exposure, identification. She was already moving before he asked. Retractor, it was in his hand. He paused, looked at her. She met his eyes over her mask. Something passed between them, understanding, or maybe just the beginning of it. Brennan continued the dissection, found the liver, found the damage. His breath caught. This is extensive. Elena leaned in. Assessed. Grade 5. Posterior segment, deep but repairable. She'd seen worse in Mosul. She'd fixed worse in Mosul. Brennan's hands hesitated, just for a second. But Elena saw it. The doubt, the fear that this was beyond him. Her voice came quiet, certain. Pringle maneuver. Occlude the hepatic vessels, pack the defect. We can do this. Brennan looked at her, really looked, and for the first time that night, he listened. Okay. Talk me through it. Elena's hands moved to the liver. This is what I do, she thought. This is what I've always done. And then she began to save him. Again. Elena's hands moved 3 steps ahead of Brennan's instructions. Retractor angled, suction positioned, gauze ready. She wasn't following his lead. She was anticipating, predicting, knowing what came next because she'd done this surgery so many times, the steps were burned into her muscle memory. Resident Jackson stood across from her. 3rd year, confident usually. Right now he looked confused. His eyes kept darting between Elena's hands and Brennan's face, trying to understand how a medical student was moving like an attending. Brennan exposed the liver fully. The damage was worse than the ultrasound had shown. The laceration ran deep. Posterior segment, grade 5, the worst kind. Blood pooled in the abdomen despite their packing. Brennan's hands slowed. Elena saw the hesitation. This is beyond what we can repair here. He needs a transplant team. No. The word came sharp. Elena didn't look up from the field. Pringle maneuver, temporary vascular occlusion, pack the defect, argon beam coagulation if you have it. Brennan stared at her. That's a combat surgery technique. We don't typically... Do you have argon coag or not? The OR went silent. A medical student didn't talk to an attending like that. A medical student didn't give orders. But Elena wasn't asking. Jackson's mouth hung open behind his mask. Brennan's jaw worked. Then he nodded to the scrub nurse. Get it. Elena's hands were already moving, isolating the hepatic vessels. Portal vein. Hepatic artery. She placed the vascular clamps. Pringle maneuver. Blood flow to the liver stopped. The bleeding slowed. 15 minutes. That's all they had before liver damage became irreversible. Elena packed the defect. Precise, methodical. The argon beam arrived. She took it without asking. Applied the coagulation, sealed the smaller vessels. Her movements were automatic, efficient, terrifying in their confidence. In the observation gallery above, Nurse Wilson stood watching. She'd come up to see, to understand what was happening. She couldn't stop staring at Elena's hands, at the way they moved, like they'd done this 1,000 times. Wilson pulled out her phone, hands shaking slightly. She typed into the search bar, female surgeon, combat thoracotomy, results loaded. She scrolled, stopped. Her face went pale. Military Medical Journal, 2019. The headline appeared. Female surgeon saves 47 lives under fire in Mosul. There was a photo. Captain Elena Vance, Army combat surgeon, 75th Ranger Regiment. The woman in the photo was younger, hair pulled back, uniform crisp, eyes intense. But it was her. It was Elena. Wilson's whisper barely made sound. Oh my God. Down in the OR, Elena's world had fractured. Sand, heat, screaming. The flashback hit without warning. Her hands kept moving, training overriding memory. But her mind was gone. Mosul, 2019. She was younger, harder. Still believed she could save everyone. Captain, we've got multiple casualties. IED strike on convoy. 15 wounded, 6 critical. The makeshift surgical tent, dirt floor, temperature 112 degrees. Bodies everywhere. Her hands moving through them, triaging. This one, this one, this one. The rest. Make them comfortable. The hardest words she'd ever spoken. 47 soldiers, 18 hours of continuous surgery. She'd saved them all. Every single one she'd said yes to. Her hands had been steady then too, even when the mortars fell, even when the generators failed and she worked by headlamp, even when she was so tired she couldn't remember her own name. 47 saves, a record. They'd written about her, decorated her, called her a hero, and then came patient 48. Elena's hands paused in the present, just a microsecond. But Brennan noticed. Vance? She blinked, refocused. But the memory was there now. Patient 48, Ranger Matthews, 24 years old, engaged, baby on the way, IED strike, shrapnel wounds, liver laceration, just like this, exactly like this. She'd been ordered to triage him out. 3 other critical patients waiting. Limited supplies, impossible odds. Captain Vance, that's an order. Focus on the salvageable cases. She'd refused. Kept working. 6 hours. She'd fought for 6 hours. Done everything right, every technique. Every procedure, but his liver had been too damaged, the bleeding wouldn't stop. And while she fought for him, one of the other patients crashed. By the time she got there, it was too late. Matthews died on her table at hour 6. The other soldier died waiting for her. 2 losses. Because she wouldn't give up. Because she couldn't accept impossible. The court-martial had been brutal. Captain Vance, you jeopardized 3 other patients for 1 hopeless case. You disobeyed a direct order. You violated triage protocol, not for incompetence, for insubordination, for caring too much, for refusing to let go. They'd given her a choice, dishonorable discharge or resign. She'd resigned. Medical license intact, military career over, everything she'd built, everything she was, gone. She'd disappeared after that, changed her name back from her married name, moved across the country, started over as a student, hid everything she knew, everything she'd done, became invisible, because if no one knew what she was capable of, no one could order her to stop trying. The monitor screamed. Elena snapped back to the present. The Ranger's heart rate spiked. 160, 180. The rhythm on the screen changed. Ventricular tachycardia. He's arresting. Brennan stepped back. Paddles, clear. No, Elena's voice cut through the chaos. Brennan turned. Vance, he's in VTAC. That's not the problem. She was already moving. Her hand shot to the Ranger's neck, felt the trachea, the deviation, the tension pneumothorax. Missed on initial survey. Needs immediate decompression. She didn't wait for permission. Grabbed a 14-gauge needle from the tray. Jackson moved to stop her. You can't just... Elena's elbow blocked him. She positioned the needle. Second intercostal space, mid-clavicular line, drove it in. The hiss of air release, immediate, satisfying. The heart monitor changed. The chaotic rhythm settled, normalized. Sinus tachycardia, still fast, but alive. The OR was frozen, everyone staring at Elena, at what she'd just done, at the impossible red, the instant diagnosis, the perfect intervention. Brennan's voice came quiet. You're not a student? Elena's hands returned to the liver, continued packing. Right now, I'm the person keeping him alive. You're not even a resident. Her hands didn't stop. Who are you? Elena finally looked up, met his eyes through their surgical masks. 3 years of silence, 3 years of hiding, 3 years of being no one. It ended here, someone who doesn't leave Rangers behind. The words hung in the air. Brennan stared, understanding dawning, the pieces clicking into place, the impossible skill, the combat techniques, the absolute certainty, the refusal to give up. You're military. Elena's jaw tightened. Was. She returned her focus to the liver. The laceration was controlled now. Packed, sealed, she released the Pringle clamps, watched for bleeding. The vessels held. No active hemorrhage. They'd done it. She began closing, layer by layer, peritoneum, fascia, muscle, skin. Her hands moved automatically, while her mind replayed everything. Matthews, the court-martial, the choice, the 3 years of exile, and now this, another Ranger, another impossible case, another chance. She tied the final suture, stepped back. The clock on the wall read, or wait 2-3, 6 hours, just like before. But this time, the monitor showed stable vitals, BP 92/58, heart rate 106, oxygen sat 94%, stable, alive, saved. Elena stripped off her gloves. Her hands were shaking now that it was over, now that the adrenaline was fading. Brennan stood across from her, staring like he was seeing a ghost. "We need to talk." Elena nodded, exhaustion hitting her, the weight of 6 hours, the weight of 3 years, the weight of everything she'd tried to bury. They began moving the Ranger to ICU, stable for transport, critical but improving. Elena walked beside the gurney, one hand on the rail, like she couldn't quite let go. The hallway was crowded, staff everywhere. Word had spread. The impossible save. The medical student who cracked a chest, the surgery that shouldn't have worked. They parted for the gurney, stared at Elena, whispered. She heard fragments. "Did you see? How did she? Who is she really?" Elena kept her eyes forward. The ICU doors opened. They settled the Ranger into a bay, connected monitors, adjusted drips. Elena gave report to the ICU nurse, clinical, thorough, like she'd done this 1,000 times, because she had. When she finished, Brennan was waiting, his face unreadable. "My office. Now." Elena followed, down the hallway, past the stairs, past the whispers, into the administrative wing. Brennan's office was small, cluttered, diplomas on the wall. He closed the door, turned to face her. The silence stretched. Then, from outside, commotion, voices, authority, boots on linoleum, multiple sets. Brennan frowned, went to the door, opened it. Elena heard it then, someone asking questions, demanding answers. Where is Staff Sergeant Mills? Where is the surgeon who operated on him? The voice was military, command, high rank. Elena's blood went cold. She knew that tone. She'd heard it before, in briefings, in ceremonies, in court-martials. Brennan looked back at her, his expression shifting, confusion giving way to realization. "Who's here, Vance?" Elena closed her eyes, took a breath. When she opened them, her voice was steady. "The people who are going to ask why I'm not in uniform anymore." And then she walked past him, into the hallway, toward whatever came next. The hospital lobby had never seen this many uniforms, not just officers. The officers, stars on shoulders, ribbons covering chests, faces that appeared in briefings and news conferences and congressional hearings, joint chiefs of staff. The hospital administrator stood in the center of the lobby, face pale, hands shaking, trying to understand why the most powerful military leaders in the country had just walked through his doors at 08:30 on a Tuesday morning. General Hawthorne stood at the front, chairman of the Joint Chiefs, 4 stars, gray hair, hard eyes. The kind of presence that made rooms go silent. Behind him, 2-star generals, 3-star generals, aides with tablets and clipboards, an entire command structure for one patient. Hawthorne's voice cut through the lobby noise. "Where is Staff Sergeant Mills? Where is the surgeon who operated on him?" the administrator stammered. "Staff Sergeant Mills is in ICU, sir. Stable. The surgery was successful. Dr. Brennan performed." He's already moving toward the elevators when Brennan appeared, still in his surgical gown, blood-stained, exhausted. He stopped when he saw the uniforms, the stars, the sheer weight of authority filling his hospital. "I performed the surgery, sir. The patient is stable, critical, but improving." Hawthorne turned, looked at Brennan like he was examining evidence. "You performed the surgery?" "Yes, sir. With assistance from... because the report we received says the surgeon was Captain Elena Vance." The lobby went silent. Brennan's mouth opened, closed. "Captain Vance isn't... she's a medical student here. She assisted, but I was primary surgeon, and..." Hawthorne's eyes narrowed. 3 words, precise, final, where is she? Brennan turned, looked down the hallway. Elena stood there, still in bloodied scrubs, hair falling from its tie, exhausted in every line of her body, smaller than anyone expected, quieter. But when she saw the uniforms, she stopped. Her face changed. Oh no, not again, not this. Hawthorne walked toward her, boots echoing on linoleum, every step measured. Elena straightened. Muscle memory. Her hand started to rise, almost a salute. She caught herself, dropped it. "Sir," the word came automatic, respectful, military. Hawthorne stopped 3 feet away, studied her. "Captain Vance, it's been 3 years." The hospital staff watched, confused. trying to reconcile the medical student who restocked supplies with the woman standing at attention in front of a 4-star general. Brennan's voice came weak. "Captain?" Hawthorne didn't look away from Elena, but he addressed the room, his voice carrying. "Dr. Vance is one of the finest combat surgeons this country has ever produced. 47 lives saved under fire in Mosul, Silver Star recipient, published in every major military medical journal, and we lost her because of bureaucratic stupidity." He paused, turned to Elena. Matthews, her face cracked, just slightly, the walls she'd built for 3 years showing their first fracture. "Sir, you were right. The board was wrong. That court-martial should never have happened. Matthews's family knows it, reached out to me personally. I know it. And today you proved it again." Elena's jaw tightened, trying to hold it together, trying not to break. "I lost him, sir." Hawthorne's voice softened. "You lost one. After saving 47, after 18 hours of continuous surgery, after doing everything right, you lost one soldier because you refused to give up on him." He gestured toward the ICU. "Today you saved another. Because you still refuse to give up." Footsteps behind them. The medical director arrived. Dr. Palmer, red-faced, furious. "Someone explain why my medical student performed major surgery without authorization, without supervision, without—" Hawthorne turned. The look he gave Palmer could have frozen fire. "Your medical student saved a ranger's life with skills most of your surgeons don't possess. She performed a field thoracotomy, controlled intercostal hemorrhage, diagnosed and repaired a grade 5 liver laceration, and identified a missed tension pneumothorax. All while your attending physician had given up." Palmer's mouth worked. No sound came out. Brennan stepped forward. "Sir, if I may." Hawthorne nodded. Brennan turned to Elena. For the first time, he really looked at her, not as a student, not as an assistant, as what she was. "Dr. Vance, I owe you an apology. We all do. I dismissed you, underestimated you, told you to restock supplies while you possess skills I've spent 40 years trying to master." He paused. "She didn't just save his life. I've never seen anything like it. The precision, the confidence, the absolute certainty. She knew exactly what to do, every step, every decision." Elena stood silent, walls still up, accepting the words but not letting them in. Hawthorne pulled a folder from his aide. "Captain, Dr. Vance," he corrected himself. "The Army wants you back. Full reinstatement, rank restored, command of your own surgical team, forward operating base assignment if you want it, teaching position if you prefer, whatever you need." Elena's eyes closed. "Sir, I can't go back to making those choices, deciding who lives and who. I can't carry that again. What if you didn't have to?" She opened her eyes. Hawthorne continued. "What if you trained others, taught them what you know, made sure the next generation of combat surgeons never has to face what you faced?" He opened the folder. "Director of Combat Surgical Training, Walter Reed. You'd develop curriculum, train residents, share your experience, make sure what happened to you never happens to another surgeon." Elena stared at the folder, at the official letterhead, at the position description, at the second chance she never thought she'd get. Her eyes moved. To Brennan, to the hospital staff watching, to Palmer still processing, to the ICU window where the ranger lay, alive, monitored, stable. "Patient 48, she thought. Matthews. This was for you." Her voice came quiet. "I'll think about it, sir." Hawthorne smiled. Small. Genuine. "That's more than we had yesterday." He handed her the folder. "My contact information is inside. Take your time. But Vance, we need you. The soldiers need you." He saluted. Sharp. Formal. Elena's hand came up automatically, returned it. 3 years fell away. She was Captain Vance again, just for a moment. Hawthorne turned. His convoy fell in behind him, boots on linoleum, precision, purpose. They left the way they came. The lobby doors closed. Silence. The hospital stood frozen, processing, understanding. Elena held the folder, stared at it. Brennan approached, slowly, like she might bolt. "Why didn't you tell anyone?" Elena looked up. "Would it have mattered? Would you have believed me?" The silence stretched. Brennan's face showed the answer before he spoke. "No, probably not." "Exactly." She turned toward the locker room. Brennan's voice stopped her. For what it's worth, I'd be honored to have you on our surgical team, not as a student, as an attending. Whatever happened before, whatever you're running from, you proved today that you're one of the best surgeons I've ever worked with." Elena considered. The offer, the recognition, the validation she'd stopped believing she deserved. "I'll think about that too." She walked away, folder in hand, walls cracking, but still standing. 6 months later, the text appeared on screen. 6 months later, Walter Reed National Military Medical Center. The lecture hall was full. 28 surgical residents, all in uniform, all watching the woman at the front. Captain Elena Vance, bars restored, uniform crisp, standing in front of a projected image showing chest anatomy. In combat, you don't have time for doubt. You have training, instinct, and the promise you made. Never leave a soldier behind. She demonstrated the technique, the same procedure she'd performed that night, intercostal vessel control. The residents took notes, asked questions, hung on every word, because her record preceded her. 47 saves in Mosul, the impossible ranger surgery, the surgeon who came back, class dismissed, they filed out, saluting, respectful, inspired. Elena gathered her materials, walked through the halls of Walter Reed. Soldiers passed, saluted. She returned each one, stopped at a wall. Memorial plaques covered it, fallen soldiers, doctors, medics. Her eyes found one, new, polished, CPT James Matthews, KIA 2022, never forgotten. She touched it gently. Her thoughts drifted. "I couldn't save you, but I can make sure every surgeon after me knows how to try." Her phone rang. She answered without looking. Captain Vance listened. Her expression shifted, focused, determined, the look of someone who'd just been given a mission. "I'm on my way." She grabbed her gear, moved with purpose through the halls toward the helipad. The text appeared. Staff Sergeant Dakota Mills made full recovery and returned to active duty. Dr. Elena Vance has since trained over 200 combat surgeons with a 94% survival rate among their patients, the highest in military medical history. Elena ran across the tarmac, helicopter blades spinning, medic bag over her shoulder. She climbed in. The helicopter lifted. Elena looked down at Walter Reed, at the place that gave her purpose again, at the second chance she almost didn't take. The image froze, her silhouette against the sky, still fighting, still saving, still refusing to leave anyone behind. Fade to black.